Welcome, everyone. This is a training for patient priorities care. There are several modules to the training. At this point, you should have completed the first, an overview or description of what PPC is and why it is needed. This module is designed to prepare you and your patients to identify health priorities. This can be done either with a facilitator or the patient can do it as a self-directed process, with or without a caregiver. This training will prepare you to serve in the role of PPC facilitator. You saw this overview of the patient priorities care process in the first training module. The first step is for the patient to identify his or her health priorities. By health priorities, we mean the health outcome goals, or the things the patient most wants to do in their life that they want their healthcare to help them with, given their preferences. That is, the healthcare tasks, medications, procedures, and healthcare visits that they are willing and able to do. After identification, these priorities are shared with the healthcare team. There are 5 main steps to help identify patient priorities. The first step is about identifying what matters most to the patient, which we call values. Step 2 is translating those values into specific, realistic, and actionable health goals. For instance, first, you will talk about what matters most to the patient, and then you'll help to decide what that actually looks like in terms of actions in their lives or doing what matters most to them. Step 3 involves reviewing the patient's symptoms and health problems. Step 4 focuses on reviewing the patient's healthcare tasks and medications. Finally, step 5 helps narrow down this information to identify the one thing the patient most wants to focus on in their healthcare to achieve a goal. These 5 steps are in service of identifying the patient's priorities. In a nutshell, patient's priorities are the health goals that the patient most wants and the health care they are willing and able to do to achieve those goals. In step 1, the patient's values are identified by a member of the healthcare team. Alternatively, the patient can work through his or her values, with or without a caregiver, on a self-directed website, myhealthpriorities.org. Values are the people and principles that matter most to the patient. In general, there are 4 broad domains of values that are relevant to older patients. The first one is connecting. One of the key areas that patients care most about is connecting with family, friends, and their community. This may also include their spiritual community, such as going to a church, mosque, or temple. Another key domain of values is enjoying life. This includes things like recreation, hobbies, personal growth, and being able to be productive. A third domain is managing health, including managing symptoms and quality of life. Patients often vary in terms of how they balance improving quality of life versus extending their life, and which symptoms they most want to manage. The fourth domain is functioning. This is often an important area for older patients with multiple chronic conditions. This relates to what a patient really wants to be independent in and which tasks they really want to continue to be doing. Patients also vary in their willingness to receive assistance and their desire to maintain their dignity. It is very important to ask about each of these 4 domains systematically. We have found that patients spontaneously only report what is salient in the moment. Thus, if we don't explicitly ask about all domains, we may miss valuable information about other domains. Prompts or cues can be helpful to identify personalized values from each broad valued domain. For example, under connecting, you may ask, which relationships or connections are most important to you right now? Under enjoyment, you may ask, what brings you the most enjoyment or pleasure? If the patient says, nothing right now, you might ask, in the last year or so, what was the thing that gave you the most enjoyment or pleasure? For functioning, you may ask, when taking care of yourself, what is most important to you right now? Under managing health, you may ask, what do you hope your health care can do for you? There are various ways to ask about these domains. The goal here is to understand what matters most to a patient within the context of his or her life and health, and what their particular circumstances are. Throughout this training, we will be presenting Mrs. B as an example of an older patient with multiple chronic conditions. Her conditions include atrial fibrillation, diabetes, hypertension, and arthritis. She often presents to her primary care physician, her endocrinologist, pulmonologist, or cardiologist with varying symptoms that include fatigue, pain, dyspnea, and urinary frequency. These symptoms have been addressed over time by Mrs. B's various clinicians. Mrs. B felt that ibuprofen helped her pain, but was told not to take it after an upper GI bleed. She didn't think that Tylenol helped. Mrs. B's fatigue had multiple possible causes, but no one clear etiology. She complained of urinary frequency that kept her from getting out of the house. When her diuretic was reduced to see if her urinary frequency would improve, she became short of breath, which also impeded her getting out and doing what she likes. Mrs. B has had 2 admissions for heart failure in the past year and 1 for an upper gastrointestinal bleed. Her primary care provider, Dr. T, isn't really sure how to balance Mrs. B's competing conditions and symptoms. Dr. T is also uncertain if some of Mrs. B's treatments are actually helping her and wonders if some of them may actually be causing more harm than benefit. This is an example of what Mrs. B's list of values might look like after the PPC facilitation. Mrs. B says, I want to be able to spend time with my family, specifically watching my grandchildren. This would be an example of a value in the connection domain. She also says, I want to be able to volunteer at the library, which is something that brings her enjoyment. Finally, Mrs. B wants to be able to lift items with her hands and to be able to walk. These are examples from the functioning domain. We've developed some tips for working through values because we have found that patients are often not accustomed to being asked about their values in a doctor's office. In qualitative interviews, patients said that it was really nice to be asked about what matters most to them, but it wasn't something that they were accustomed to being asked. Instead, they're very accustomed to coming in and giving a list of symptoms such as pain, difficulty sleeping, or urinary frequency. PPC is really moving the conversation from the standard, what is the matter with the patient, to what really matters most to the patient. If a patient starts the conversation by discussing a healthcare burden or problem, redirect the discussion to focus on values. You can do this by asking the patient how the symptom or problem is actually interfering with living a life that's meaningful to the patient. For example, if a patient comes in and says, "I'm having a lot of pain. I want to get rid of the pain." You might ask, "What would you be doing more of if you didn't have the pain?" This will provide information about what the pain is actually interfering with. The same approach works for other bothersome symptoms. For example, if a patient tells you that their urinary frequency is really bothersome, you may ask, "What is the urinary frequency interfering with? What is it getting in the way of? What would you be doing if you were having a good day when this is less bothersome?" The answers to these questions will help direct you and the patient to what matters most. Another possible challenge is that patients may feel a sense of duty to say what they think a clinician or family member wants to hear, instead of what they truly believe. It's important to stress that there are no right or wrong answers. People vary in what matters most to them and what they most want to accomplish. For example, you may say, "I want to make sure that I understand what matters to you, not what other people care about." There are no right or wrong answers. Patients initially may not be able to articulate their values. It's okay if patients need time to think about the questions you have asked, such as who and what is important to you at this time. What brings you pleasure? What do you feel like you're missing out on? So that's step one. Trying to get a sense of the core values of the patient is really at the heart of the identification process. As you will see in step two, the health outcome goals are based on these values. Step two involves translating what matters most into specific, realistic, and actionable goals. Health outcome goals are the ways that people put their values into action. These are the activities the patient wants to keep doing in his or her life or hopes to do more of. Let's review a few examples of going from a broad value to something more specific and actionable for the patient. If spirituality is important to a patient, he or she may say, "I want to be able to go to church once a week, but I can't drive." If enjoyment is important, the patient may say, "I want to be able to garden once a week, but I don't have enough balance to do that." Again, here we are going from broad values to something more specific and actionable for the patient. Let's delve a little deeper now. Health outcome goals need to be specific, realistic, and actionable within the context of the patient's life and health. They must also be linked to values. When you're trying to identify a goal with a patient, try to get specific and clarify exactly what the patient wants to be doing. You may need to ask the patient, "What would you do specifically?" And this may change over time. It's also important to make sure that the goal is realistic. This means that it is something the patient is able to do given their current health conditions. To determine if a health goal is realistic, you may ask, "When was the last time you were able to do this activity?" Or you may state, "Maybe we need to work our way up to that activity. Where do you think is a good place to start?" Unless it is completely unrealistic, try not to say, "Well, I really don't think you're going to be able to do that right away." Try to be aspirational and supportive at this point. In a lot of cases, you're not going to know exactly if it's truly realistic or not. It can be refined in the future. Let's take Mrs. B as an example. In step 1, Mrs. B said that being a grandmother was really important. Now we would like to try to understand what that looks like in her daily life. You take the broader value from step 1 and translate it into something specific and realistic, an actual goal, such as watching my grandchildren 3 times a week. Identifying a specific and actionable goal allows the clinician to decide on health care that aligns with the patient's goals. For example, when Mrs. B sees her PCP, he may ask, "Have you been able to watch your grandchildren more since we have decreased the dose of this medication?" Or, "Have you been able to drive now that we have increased this medication?" The goals will be used to figure out whether the treatments have worked for the patient or not. Again, it is crucial that goals are linked to what matters most to the patient. If the goals are unrealistic, you can collaborate to identify a more realistic goal that still honors the same value. Having an understanding of the value underlying an unrealistic goal allows for opportunities for the patient and clinician to collaborate on more realistic options. For example, a patient may say, "I want to be able to get my driver's license." But that may not be realistic for this patient. If you know the value that underlies this goal, you can work together to identify another realistic and specific goal that still honors the value. For example, if the value is self-sufficiency and the patient wants a driver's license in order to go grocery shopping, he or she could research vision and hearing aids so that they can use the computer to order things online. Self-sufficiency is more related to them being able to buy things themselves rather than relying on someone else. Even if they can't drive, you can find another goal that can help them feel more self-sufficient. If the value is connection, and the patient says she wants to drive to visit friends or family, then he or she may ride the bus to the senior center or get a ride from a family member to a gathering. You need to first understand why it is that they really want to be driving. to work towards identifying other ways that they can still live out that underlying value if driving isn't going to be a possibility. Exploring a patient's understanding of their health trajectory and compassionately sharing your perspective on capabilities can also be important. For example, you may say, as time has gone by, you have had a number of changes in your health. We are in a different place now. Let's think about other ways we can help you feel engaged in your community. Let's do an exercise that will help clarify the difference between values and goals. One way to help distinguish between values and goals is to consider if it's something you could check off of a list. If so, it's a goal. As we go through these examples, think to yourself whether it is a goal or value. If a patient says, I want to be able to go to a religious service each weekend, is that a value or a goal? It's a goal, a concrete action that can be completed. This may reflect an underlying value of connection. What if someone says, I want to be as independent as possible? Is that a value or a goal? Can you check it off a list? Can you say, I did this, I'm independent, I'm done? Not really. So it's a value. Independence looks different for different people and in different stages of life. For a healthy 20-year-old, independence may be reflected by living independently. For an older patient with multiple chronic conditions, it may be bathing by oneself. What about contributing to my community? Is that a value or a goal? It's broad and it is a value, describing exactly what a person would do to contribute to his or her community would be the goal. What about getting a new job? It's a goal. You can check it off the list. You don't really know what the value behind the goal is. Is it to be more independent or to have more connection? You don't know. It's important to recognize that an effective goal in PPC is one that is realistic, specific, and actionable. When working with a patient, it's important to discuss whether the goal is specific and realistic. As we discuss each goal, think about whether it is specific and realistic. Let's say a patient has a goal to be healthier. Is that specific? No, it's not, because there is no clear activity. For example, do they mean healthier eating, physical activity, sleep, taking medications? Is it realistic? Yes, there are always activities to move towards being a little bit healthier. What if someone says, starting this week, I'll watch my grandchildren after school 2 to 3 times a week? Is that specific? Yes. This is a precise activity with a specific frequency and time frame. What about realistic? It sounds like it, but also it depends where they're starting from. If they were already watching them once a week, but want to increase it, then maybe that is not a big jump. But if they haven't watched them in the last 3 months at all, then that might be too much to start with. Here's another example. I will start jogging a mile every day before breakfast. Is that specific? Yes, it's a precise activity with a specific frequency and time frame. However, it's probably not realistic for our patient population, or me. Here is Mrs. B again. What questions might you ask to help her verbalize a health outcome goal? Let's start with her values. We know she wants to be connected to her grandchildren and wants to walk and hold library books. What would she be doing specifically with her grandchildren? For how long? How often? How has this been going lately? When was the last time she was able to do these activities? What kinds of activities would she like to do with her grandchildren? These questions can lead to more specific goals that Mrs. B can realistically start working towards. For example, I want to watch my grandchildren after school 2 to 3 times weekly. And I want to volunteer in the library handling books 2 times weekly. So we moved from the broad values of wanting to care for her grandchildren and volunteer in her community to getting specific weekly goals. In summary, a patient's health goal is an activity they most want to do that their healthcare can help them achieve. Identifying a specific and meaningful goal allows the clinician to decide on healthcare that aligns with the patient's goals. For example, when Mrs. B sees her PCP, he may ask, "Have you been able to watch your grandchildren more since we've decreased the dose of medication?" Or, "Have you been able to drive now that we have increased the medication?" The goals will be used to figure out whether the treatments have worked for the patient. In the future, getting to the patient's goal is a measure of how successful the care plan is. As noted above, identifying patients' priorities involves 5 steps. We just covered steps 1 and 2. The first step is about identifying what matters most to the patient, which we call values. Step 2 is translating those values into specific, realistic, and actionable health goals. That is, first you will talk about what matters most to the patient, and then you'll help them decide what that actually looks like in terms of actions in their lives. The next training will review steps 3 to 5. In steps 3 and 4, the patient will identify symptoms and health problems and will review their healthcare tasks and medications. In step 5, all this information will be narrowed down into the one thing the patient wants to focus on in his or her healthcare to achieve his goal. Here is a summary of resources available to support facilitation of patient priorities care.